Hi, my name is Dr. Mike Hennings. This is our second video, spinal decompression therapy. Again, background, I am a board-certified chiropractic neurologist practicing full-time in Palm City, Florida. We did another video last week and it was about disc herniation. It was about some of the misconceptions that are out there about disc herniation, and I added a teaser in there about spinal decompression therapy being the #1 treatment that we see for disc herniation. It's better than surgery statistically. 92% of people get relief from spinal decompression therapy. 73% of people get 100% resolution across the board, and those surveys were taken a year after treatment was done. So we know that overall it is highly successful. It doesn't work for everybody, and it works really very well for more than just disc herniation. We see people with joint problems, with arthritis, somewhat with stenosis that do okay with decompression therapy even, and it works really well for those folks out there that are suffering from things like sciatica, where the pain is running down the leg as a result of the nerve being compressed in the back. So what I'd like to do over the next couple minutes is illustrate how spinal decompression works, how somebody is placed on a table, exactly what you can expect if you're a candidate for decompression therapy, and what are some of the contraindications, what are some of the no-nos that would make you not qualified to go through it. Really, there's only a couple of those, by the way. We're not able to do spinal decompression therapy on anybody with active bone cancer. Really, nobody with fractures is really supposed to go through spinal decompression therapy, although we see some fractures like spondylolisthesis where they tolerate decompression therapy just fine. So that's sort of a gray area. There are really not much in the way of other disqualifying factors for decompression therapy. Certain blood clots, certainly abdominal aortic aneurysm, you're not going to be going on the table. Pretty much everybody else is worth a shot though. There are no side effects to it except for soreness. Most people do really well with it. I usually tell people to ice 20 minutes on, 20 minutes off afterwards, and most people say that they do pretty well. They're pretty stiff when they get off the table. The next day they feel like $1,000,000. The trial is about 3 visits. So in other words, statistically speaking, if you don't get any better within 3 visits, it's not likely you're going to get any better. So we just stop at that point. We also know that through the research that was done, which was thousands upon thousands of participants in the research studies, again, 76% of people, or 73% of people had total resolution in their pain. 46% of people went through 9 visits. The remainder of the 73% had to go through 18 visits. There is no statistical benefit to going through more than 18 visits. And some people do 3 or 4 visits and they're totally better and they just stop at that point. That's perfectly okay with me. Decompression therapy is a tool that we have. There are a lot of tools that are available. Chiropractic care, manual manipulation is a big benefit. It's a big, spinal decompression therapy is more of an adjunct to other physical therapy or chiropractic type techniques. Massage therapy works really very well. Sometimes we'll even add pharmacotherapy, medications or injections where we're lowering the muscle tension. And what that does basically is helps the spinal decompression therapy be more effective. There are a couple of factors that we have to be careful with spinal decompression therapy that combat the therapy itself. One is muscle spasm. So anything we could do to lower muscle spasm, like stretching, manual manipulation, muscle relaxers, massage therapy, injections like trigger point injections to lower spasm, that allows the therapy to be more directly therapeutic to the discs themselves. Let's talk a little bit about disc herniation and sort of what that means. Now, the first thing you should do, of course, is look at the last video we did, which should be on our YouTube page already. But in a nutshell, I am a chiropractic neurologist and video director on the side. So you have to bear with me. This is your spine, okay? This would be the back side of the spine. These are the discs in between each of the white things, which are the bone. These are vertebrae. And basically what we're looking at here is the discs are being compressed in a disc herniation. The idea behind decompression is taking the compression off of the discs. So if we stretch the spine out, it creates a vacuum effect. It draws fluid in to the discs themselves through these honeycomb-like bones on either side. And as we take the pressure off those discs, we have these nerves here. These nerves are being freed up to move without restriction. As the discs are compressed, space becomes a real issue. So that's what we're looking at. Luckily enough, for our viewing pleasure, MJ, our office manager, is going to come on over now, and she's going to help us illustrate what somebody goes through when they're on a decompression table. Now, the first thing is the table itself. So let's see if we can get a better view. This is what a spinal decompression table looks like. This is a Chattanooga Triton DTS style decompression table. A couple of factors that we'll look at. There is the pillow. This is where the head goes. This, by the way, this is set up for somebody with lumbar decompression. This is somebody who has low back problems. The other option is that we can set it up for a neck decompression, and we'll see if we can try some of that here in a little bit. MJ, come on down. Let's see if we can illustrate this a little bit better. She didn't know today she was going to be world famous on the internet, but hopefully she will be. Okay, so let's lay you down. Let's start with that. Okay, so one factor we're going to note is that the table has a couple of parts, and these parts include a pelvic piece and a leg piece, and then of course there's the upper back piece. The idea here is that these two separate apart from one another. So there's a divide in the table, and what we're going to do is we're going to unlatch the table. Now the bottom half of the table is spring-loaded, so if we're taking this half of the table and pushing down towards the feet, the top half of the table stays stationary. The idea is that everything in between gets stretched apart, and that creates that vacuum effect. Let's see if we can actually do a full setup here. Without getting wires in the way. All right, so I think that'll do. So essentially what we're going to do is strap in the top half of the table. Nicely done, just like that. This is the belt that's going to connect to the traction unit. And then the top half of the patient. Very nice. And let's see if we can even get an idea of okay, now this is one of the important features of decompression therapy. We have a stop button. So the nice thing to know is that if you're going through decompression therapy and you don't like what's happening, you hit this red button and it sets off the fire alarm. No, I'm just kidding. It just turns the machine off. So if you are uncomfortable and you're nervous about trying it, you do have the ability to stop it if you don't like it. So that's really the biggest thing you have to worry about. Well, while MJ gets decompressed, let's go over some of the parts here. So again, the top half is stationary. Bottom half is being pulled by this traction unit. This is connected directly to the machine. And this is, again, it's decompression. Decompression is what happens to the discs, but it's an intermittent traction. The important difference about intermittent traction versus static traction is that static traction doesn't work. So, you know, hanging your head off the from a water jug that's slung over your bedroom door is okay. It's absolutely fine. It's not going to do any damage likely, but the benefit of intermittent traction is that after about a minute, your body goes into spasm. So remember, you've heard stories of people being in traction for a week in the hospital. We don't do that anymore. What we're doing now is this stretch release accordion style. And what's happening here is that you can see the green is how high we're going, and eventually clearly what's going to happen is that the machine is going to drop down, stretch, release, like an accordion, so that the body never has a chance to go into spasm. And after about 15 minutes, the machine releases. She's going to get up. She's going to say she feels like a whole new person. And then she's going to come back for the remainder of the 9 to 18 visits, likely, hopefully less than that. So we're going to let MJ get back to work, and I'm going to unstrap her for the table. But hopefully you learned a little bit about spinal decompression therapy. And if you know anybody with disc herniations or disc herniation-like symptoms like radiating pain, hopefully you'll have them come in and give us a call. 772-220-5880. Again, my name is Dr. Michael Hennings, board-certified chiropractic neurology in Palm City, Florida. And until we get to see you, check out our website, henningschiro.com, Facebook, henningschiropracticneurology.com. And of course, always send emails. We're happy to answer questions on YouTube video format, so that you can get the questions answered without actually having to come in. Thanks so much, and good health.